Now, I've shown some slides where I think we can be proud of progress that's being made, but I want to put up a more challenging slide because I still think there is a lot to do when it comes to patient safety. We still have 2 examples of wrong site surgery every week across the NHS, 2 examples of foreign objects left in people's bodies every week. We still, according to the Hogan and Black analysis, have 150 avoidable deaths every week. And we still have, according to the Fremantle study, a weekend effect, which sees mortality rates for weekend admissions around 15% higher. Now, I know there's been debate about statistics, and I would simply say this: let's not make the mistake we made at Mid-Staffs, where we spent 4 years arguing about the HMSR and shimmy methodologies, and we didn't get on with improving care for patients, and we mustn't make that mistake again. And I think when it comes to safety, we are making some really important progress. Earlier this year, we had the first ever global ministerial level patient safety congress in London. Margaret Chan from the World Health Organization came, and she said the WHO will now have a global patient safety day. Johns Hopkins University a couple of months ago said that medical error was the 3rd biggest cause of death in the United States, behind cancer and heart disease, 250,000 deaths a year in the United States alone. And in this country, we have set up the Healthcare Safety Investigation Branch, modelled on the kind of no-blame investigations that the airline industry has. And I'm delighted that the first head of our Healthcare Safety Investigation Branch will be Keith Conradi, who has been heading for, I think, the last decade, the Air Accident Investigation Branch, and knows all about how you do investigations that are designed to be quick, get to the truth, and disseminate knowledge as quickly as possible so that the same mistake isn't made in another part of the system. We have plans for safe spaces legislation so that doctors and nurses can speak openly about mistakes that they've seen or they may have made without having to worry about litigation or professional consequences for themselves. The transparency revolution continues with Ofsted-style ratings, not just on mental health, but on diabetes, cancer, dementia, learning disabilities, and indeed for CCGs themselves. We're also going to be publishing later this year hospitals' own estimates of their avoidable deaths in their own trusts, which will be a big step forward. And, you know, it is true there is a huge amount to do, but if it seems daunting, just say to yourself, which other healthcare system anywhere in the world is taking a root and branch look at patient safety and trying to transform it across an entire health economy? And that's why I do believe that we can become the safest and highest quality healthcare system in the world if we carry on engaging with this issue in the way that I know all of you are. So I want to say a very big thank you for all that progress that we're making.